Welcome, everybody. This is what I'm calling a primary care pediatrician's primer on gender. And my name is Danielle Lum. My pronouns are she, her. I have nothing to disclose. The first thing is glossary, so that we're all using the same terms and know what the terms mean. So sex assigned at birth. When a baby's born, they're given a sex, male, female, and put on their birth certificate. And rarely they have ambiguous genitalia or atypical genitalia now is the most common term used. And that occurs in 1 to every 1,000 to 4,500 births. But as you'll notice, even from my little cartoons at the bottom, blue is for boy and pink is for girl. So we start having cultural stereotypes about gender even from when they're born. And girls wear little ribbons in their hair and boys do not. So gender identity, what is gender identity? Gender identity is a person's internal, deeply held knowledge of their own gender. So it's something in your head and your heart. It's not something visible for others to see. Most people, their gender identity matches the sex they're assigned at birth. And for some, it doesn't. And for some people, they don't fit into the normal or the typical, I should say, male, female binary. And we'll talk about kind of how those people call themselves in a minute. So cisgender. Cisgender is an adjective. It's used to describe a person whose gender identity is aligned with the sex they were assigned to at birth. So in a sentence, you can say, she is a cisgender woman. And you can cut it down to cis for short, and you can say he's a cis man. But because it's a verb, because it's an adjective, not a verb, there's no such word as cisgendered. Just as you can't add ed to the end of an adjective like tall, you can't say he is a tall man. You can't say that she is a cisgendered woman. And I'll get to why that's important when I talk about transgender, which is the next slide. So transgender, it's also an adjective. Again, it's used to describe people whose identity is different from the gender identity or the sex they're assigned to at birth. It does not depend on your physical appearance or having had medical procedures. And you can shorten it down to trans. You can say he's a trans man. So a transgender woman is someone who is assigned male at birth but identifies as female. And transgender man, somebody who's assigned female at birth but identifies as male. There are some in the trans community who do not identify themselves as either strictly male or female and have other terms to describe themselves, and we will talk about that in a minute. So transgendered, and that's an offensive term to the trans community. And the reason is it's offensive. It suggests that transgender is not a state of being. It's so I'm a transgender woman. I did not become a transgendered woman through my thoughts or actions and so forth. It's who I am. So I think that's why that term is considered offensive to those of us in the trans community. Tranny is an offensive term. Transsexual, some people consider it offensive, some people don't. I think if you're kind of doing, I don't know, those SAT questions, transsexual is to transgender as homosexual is to gay or lesbian. So it's an older term that is used and has kind of fallen out of favor. And I think in some circles, maybe homosexual had negative stereotypes associated with it, and maybe transsexual did before too. And for other people, they said, nah, it's just the term, and so they don't worry about it. Cis and trans, I hope this doesn't cause PTSD, but so if you're trying to remember, cis is a Latin word meaning on the same side of, and trans meaning on the opposite side of. And so from your organic chemistry classes, the CH3 moieties are on the same side in cis-2-butene, and they're on the opposite sides in trans-butene. And I'm going to get off of that in case I'm causing anybody more PTSD. Non-binary. So people who identify as either both man and woman, or have neither man or woman, or some other descriptions or combinations, their they're under the category of non-binary. So they may call themselves agender, bigender, gender fluid, pangender. And some people in the who are non-binary consider themselves part of the trans community, and others do not. They consider themselves as a separate community. Mahu. Mahu embrace both male and female gender identities. And early Hawaiians, so they really would be considered non-binary. And early Hawaiians valued and respected Mahu as healers, caretakers, and teachers of ancient traditions. So I think part of that is also is why we in the islands probably have are maybe more accepting of transgender people here, and also probably why more of us are out, just because we are more accepted. Gender queer, it's pretty much synonymous with non-binary. I mean, I think there may be subtle differences of which I'm not really very well aware of. The one other thing about gender queer is, in addition to it being somebody's gender identity, it can be used to describe somebody's gender expression. So what is gender expression? So gender expression is the external manifestations of gender, and it's your name, your pronouns, your clothes, your haircut, your voice, other behaviors. Those are your gender expressions. So you can see somebody's gender expressions, but whether you can consider that gender expression masculine or feminine really depends on their culture, and it changes over time. So Leslie, for example, used to be a much more feminine name in this country. I'm sorry, much more masculine name in this country, and now it's pretty much only a feminine name. Gender non-conforming. So this is a term used to describe people whose gender expression differs from conventional expectations. So there are cisgender people who are gender non-conforming in their expression of their gender. So the picture on the left is a picture of Diane Keaton in the movie Annie Hall, and we'd say that her clothing is gender non-conforming for a woman. And then Harry Styles is pictured on the right, and that's from Vogue magazine in 2020. And we would say, well, his gender expression is pretty non-conforming for a man in this day and age. So you don't have to be transgender to, or transgender people can be gender non-conforming, but they can also be very conventional in their gender expression. So if you look at me, you'd say, well, you would think that I'm pretty gender conventional in my appearance. And for some transgender people, conformity may be a matter of necessity. So in order not to suffer abuse, for transgender people, they may have verbal ridicule or physical assault if they're kind of found out to be transgender by being non-conforming. And indeed, societies demand conformity. Some societies more than others. I think most of you are aware of the woman Masha Amini, and she's the Iranian woman who was severely beaten and, for all intents and purposes, executed for not wearing her hijab properly. So again, there may be reasons for conformity other than just gender expression. Annie Hall trivia, just really quickly. It was a 1977 movie. It got 4 Academy Awards. It grossed $44 million, which is really a lot for the 70s. And Trudy Capote, he did a cameo in the movie. Woody Allen quips to Diane Keaton as they're sitting on a park bench, "There was the winner of the Truman Capote lookalike contest." And the man walking by was actually Truman Capote. So sexual orientation. So this is what a person's physical, romantic, or emotional attraction or attachment is. So it's different from gender identity, and it can be different from the binary of straight or gay. So people can be bisexual, pansexual, queer, asexual, etc. So I don't know, somebody once told me a way of thinking about sexual orientation versus gender identity is sexual orientation is who you go to bed with, and gender identity is who you go to bed as. Not sure if that's the best way to think about it, but it was one way of, quick way of being able to kind of separate the two. You might see SOGI somewhere written down, and most of the time it's in the context of data. So the sexual orientation and gender identity are lumped together for data purposes and not because they necessarily, assort with one another. So then in terms of transgender individuals, if you're a transgender woman and you're romantically attracted to other women, then you would, as far as your sexual orientation, you're a lesbian. Transition is another term that you're going to hear. And then transition is the process where people bring their gender expression or their bodies into alignment with their gender identity. So there are three types for all intents and purposes. There's social transition, where you tell your friends and family, hey, this is my name, or these are my pronouns, or you start dressing differently or talking differently, or wearing makeup or not wearing makeup, or etc. And then under legal transition, you might be changing your name or your gender marker. And then medical transition would be things like hormones and surgery. So then when you're doing, or when we are doing this as healthcare professionals in terms of assisting patients with transition, this is what we call gender affirming care. So gender dysphoria. Gender dysphoria is a DSM-5 diagnosis. So it's for the, there's a slightly different diagnosis for children and for adolescents, and I'll show you in another slide next about the criteria for children. But the criteria are essentially have three components. It's the incongruity between your affirmed gender and the sex you were assigned at birth. That's number one, and the way you kind of discover the provider would kind of know that is by those bullet points. And then it's a long-lasting situation, so it lasts at a minimum of 6 months. And then thirdly, it's a condition where there's significant distress or impairment, as the word dysphoria would kind of suggest. And so for kids, this bullet list is slightly different. As you can, I'm not going to go through the whole list, but that's because kids express themselves differently. They may not have as much language in their as their ability to say kind of who they are, but the same basic three criteria apply. So the importance of dysphoria or impairment or distress comes into play when you're thinking about treatment. So if there's little or no distress or dysfunction, then doing a procedure that has significant risks doesn't make a whole lot of sense. And to get a sense of dysphoria, since most of you are not transgender who are listening to this right now, I think here's a way of thinking about it. Do this thought experiment. For those of you who are cis men, think about how you'd feel if you started to develop breasts and you started to menstruate. For those of you who are cis women, think about how you'd feel if you started to grow facial hair, your voice deepened, and your clitoris started to look more like a penis. And so that's, I think, the sense that transgender people feel, or that's the discomfort that trans people feel, that we feel, and why we might want to, be different from kind of how we appear, or how our bodies are. So I hope that helps kind of you all who are cis out there kind of get a little better understanding of how we feel. Pronouns. I'm not going to define pronouns. You know what pronouns are, but I want to talk about them. So, I mean, the ones that are obvious are she, he, but then we have at the very bottom of this list is they. And so non-binary people will often use they, them for their pronouns. And it's a little hard to get used to using they, them. It's a little awkward. For example, in a sense, I could say, it had been a long time since I had seen Terry, but I ran into them last week. And it's not that awkward, but it's a little bit awkward. It's also hard if you've been using this particular pronouns for a given person, then all of a sudden they switch. So if you're used to calling somebody he, him, and now that person says, well, please use she, her. Then it's almost like, you're having to fight against muscle memory. And so you do make mistakes. I mean, actually, if you listen to native Chinese speakers, you'll hear them say she, he, and that's because actually there is no she or he in Chinese. Ta, the pronoun in Chinese really translates to a singular they. So, but my point about this is that if you make a mistake, don't make a big deal about it. Just correct yourself and a brief apology and move on. So you could say something like, sorry, she told me that the book was hers. And that usually kind of gets you back on track. The other thing is that if you're, you feel like you're having a hard time using they, them, or especially these neopronouns, this whole group of pronouns in the middle of this list here, take your time, just speak a little more slowly, and that'll help you as far as being able to keep being able to say the pronouns properly. So 2% of LGBTQ people use these neopronouns, and the list is is even longer than the 1, 2, 3, 4, 5 that I've listed here on this slide. The neopronouns, even though it says neo meaning new, some of them have been around for a long time, but then they just kind of stopped being used and they've kind of been resurrected. And you can use them kind of like you'd use other pronouns. So instead of saying she said the book was hers, you might say Z said the book was theirs. If you don't know what somebody's pronouns are, ask them. So it's polite to introduce yourself saying, hi, my name is Danielle and my pronouns are she, her. What's your name and what pronoun do you use? And I think, if we start getting used to using that language more often, then people who use different pronouns will be more comfortable in telling you their pronouns. We're going to take a little diversion. My father used to put these in his lectures, so I'm doing this as a tribute to my dad. So these are called droodles, and what's this? It's a trombonist in a phone booth. Caution, do not invert the image. I wonder why that would be. Oh, why it's this. It's a child trombonist in a phone group. And for those of you who are thinking otherwise, this is a talk of pediatricians, not neurologists. So next section, parental FAQs. So, you may get asked, is my child transgender or is this a phase? Aren't they too young to know? So one thing you need to know about is what's normal gender development for children. So around age 2, children become aware that there are physical differences between boys and girls, men and women. Around 3, they usually can label themselves as a boy or girl, and by 4, most of them have a stable sense of their gender identity. So, but during these toddler preschool years, they're learning about gender roles, and they're also they're doing pretend play and things like that, and exploring. And so you might find that they're boys are wearing a dress or doing other things that are cross-gender, but it doesn't mean that they're necessarily going to be transgender. And then if you get asked that question, I think one of the things you might say, well, it's less relevant as to whether this is a phase or whether your child is transgender, but really, are you providing a supportive environment for your child so that they can explore their gender? And I think the supportive environment is extremely important, and I'm going to show a little bit of data later on as to why that might be. Other things about gender development in children, the timeline for transgender children is really the same as the timeline for cisgender children, but transgender kids may not be able to express their feelings, especially if they're being silenced by the adults and other people around them. And so I want to go through an interesting study that kind of supports this contention. So Solomon Ash was a psychologist back in the 1950s, and he studied students at Swarthmore. And so what he did was he had 50 student volunteers, and they sat in a room. There were 8 students in the room, but only one was the subject of the experiment, and the other 7 students there were actors. So the actors knew what was going on, and the one other student that was in there who was the subject didn't know what was happening. And so then the students were told, match up the line on the left with the corresponding A, B, or C on the right. And so then the actors all answered first, and then the subject answered last. So they just kind of went down the row, and the actors had a script so that in the first few rounds of this experiment, all of the actors would say, well, the answer is C. And then so when it came time for the subject to answer, they'd answer C because it's the correct answer. But then in subsequent rounds of the same exercise, the actors then uniformly picked a different answer. So they'd all answer A. Then the question was, well, what would that subject do, that eighth person who didn't know that the actors were, pretending? What would they answer? And it turns out about, 25, 30% of the time, the subject would actually answer A, even though, C was clearly the obvious answer. So I think that, just goes to show you that, kids who are kind of, even if they are transgender, but everybody is telling them, they know they're a girl, but everybody's telling them, no, you're a boy, you're a boy, you're a boy. That they might have a hard time asserting, their true gender identity. But if they do assert themselves, and it's consistent, persistent, and insistent, then chances are they're transgender. So consistent means that, they continually say, I am a girl. They don't sometimes say I'm a girl and sometimes say I'm a boy. It's persistent, meaning it happens over months and years that they keep saying they are that gender. And then it's insistent. If somebody says, "Oh, you're a boy," they go, "No, I'm a girl." That if you have all three of those boxes checked, chances are that child is likely to be transgender. But if you don't have all three boxes checked, you can't rule it out. Did I somehow cause this? I mean, I think, our parents have been asking this for forever, really. I mean, when your child, when you tell the family that the child has a life-altering medical diagnosis, whether it's leukemia or ADHD or whatever, I think the parents will ask that question, and we're actually pretty good about saying, no, of course not. And so we need to tell this same thing to our parents who have LGBTQ kids, that no, you didn't cause this. If they ask, if they want some sort of scientific explanation why, you can point to the fact that there are neuroanatomical difference in transgender individuals, and that their neuroanatomy looks more like their gender identity than it does their sex assigned at birth. You can point to twin studies where identical twins have a higher concordance with being transgender than fraternal twins. You can look at attempts for people to try and change people's gender identity, and they've really been very unsuccessful. Conversion has been really it's not only unsuccessful, it's unethical. And then lastly, you can look at hormones. And so if you look at children with congenital adrenal hyperplasia, and so these would be XX females who have been exposed to a high level of androgen at birth, about 10% of those kids turn out to identify as male later on. Is it okay to feel sad or confused? Well, yes. Parents' fears, they're real. There was a recent study from Australia that showed lower quality of life scores among trans kids and teens, and bullying really does occur to trans kids. So we all have expectations of our kids. We worry about discrimination, if we have a trans kid. So yeah, absolutely. I'm gonna do a quick video clip next, and I've got to hit that just kind of talks. It goes through kind of parents kind of discussing how they felt with them, kind of finding out how they have a trans kid.
Follow the lead of their kid, which is very antithetical to how we function as a society. So it's very hard to kind of wrap your brain around as a parent at first, because you're like, well, my kid wants ice cream in the morning too, but I'm not going to tell them they can have it, right?
Yeah, I was not down with that in the beginning.
Yeah.
Yeah.
Sean's like, this is crazy.
I was
We're
like,
not just going to follow a
any
kid.
child.
We bumped heads on that, you know.
We
We definitely.
It was a struggle, you know. It was like, are we going to be able to come together for our kid, like, you know, but also leave room for our own reactions, like, you know, and that's what I wasn't navigating so well, because I was scared.
Yeah.
You know, I had a lot of fear.
You're going to have emotions that you're going to have to try to figure out how to deal with them, you know, or that you might even feel bad about. You know what I'm saying? There can be a feeling of loss or mourning of the child that you thought you had. And it doesn't mean you don't love the child you have, but it's complicated. It's a very complicated process.
It's okay to ask questions and be in that gray area of grief. Allow yourself that, but also understand that no matter what, you have unconditional love for your child.
Forgive yourself for conversations that you might have had, for micro expressions you might have given. Our kids forgive us because they have unconditional love for us, and that our unconditional love for them shows through as well.
It's going to be okay.
Yeah.
But it's going to be okay. Not to be, it's okay to be afraid, but of things that maybe we don't understand, we don't know, we're not educated, but we can get educated, we can move forward, and it's going to be okay.
Too much in society, if there's something that we don't understand, we're so dismissive and want to immediately jump to the conclusion of that's wrong because I don't know it and that's not my experience. But that's not reality.
With support and the clear sense of unconditional love, these children will be okay. They will. They're challenging, you know, they're challenging passages. But if we can make it clear through our actions and through the places that we take them, that there's a place for them in this world, that they have a right to be here. They've always been here.
I hope that it gives you a flavor of parental feelings, and it also segues nicely into the next section, which is what do we, how do we help these children, or what's the best, if the parent asks, what's the best way to help my child right now? It's that give them that unconditional love, stay positive, listen to them. I mean, again, you don't have to give them ice cream necessarily, but listen to what they're saying. Act out of love, don't act out of fear. And then have a supportive environment. Don't beat yourself up. Again, you know, I think it's like, you know, your kid will forgive you. Have activities that allow the child to express themselves. You know, allow them to be around gender diverse friends. So there are camps now for transgender kids, and that's really been I think a great boon for these kids to be able to be around kids like themselves and just to be themselves without having to worry about whether they're going to get, you know, pushback from somebody else. Don't assume your child's gender expression is a form of rebellion or defiance. And then, you know, understand that, you know, discrimination, it's not their kid's fault. It's, you know, it's the others around that maybe, you know, that's where it's coming from. It's not because of your kid. So why does parental support matter? So this was a Canadian study, and it was for trans youth who were, you know, teenagers to young adults. And they polled them, and they segregated them by those who had very good parental support by report, and those who were either somewhat or not supportive, who had parents who were somewhat or not supportive. And you can see in terms of housing, life satisfaction, and self-esteem, they all had higher scores than if they had good support than if they didn't. And they had lower numbers of depressive symptoms as well as suicidal attempts for those who had good support for this versus those who didn't. So parental support really matters. As far as, if they ask, well, what should I, or who should I tell at my child's school, and should I tell my the people at school, and should my child tell their friends? I mean, those are commonly asked questions. And it's a tricky situation. So if you're staying at the same school, then there's really no, and you come out, then you're going to be out to everybody, and there's really not that, you really can't do anything about that. Everybody knows. So, but then there are some families that decide, well, we're going to switch schools in whatever grade and have the child go to a new school. And then the question is, if you do that and you remain stealth, if you don't disclose to everybody that your child is transgender, what are the implications of that? And so you might just do it on a need to know basis, just the teacher and the principal. The reason for doing it would be, if you disclose, then it's the toothpaste is out. You can't put the toothpaste back in the tube, and their bullying really is a real problem. So you only need one bully in the school to make life miserable for your child. I think that's why parents might choose to do something like this. On the other hand, when the child says, "Well, can I tell my best friend?" And you say, "Well, we don't think that's the best idea," but you're telling them, "Well, you should be proud of who you are, and we support you in being transgender, but you shouldn't tell anybody." That mixed message is just, I think, a little hard for kids to kind of figure out why that should be. So it's a kind of a difficult question, and I think each family kind of has to kind of go their own path with that. And I would imagine that your choice might be different here in Hawaii than it would be in Oklahoma or Texas. What about bathrooms and PE class? So, for younger kids, it's not too much of an issue. Just use the stall for the bathroom. And PE class, again, if you're changing, it might be a little more problematic, but you still probably have some ability to, not disclose that you're transgender, even in PE class and the locker room. What does the DOE say? So the DOE definitely prohibits harassment and bullying. There's a law called FERPA, which protects the students' right to privacy. So they can't put, somehow out the transgender child if the child didn't, and then the family didn't want that. And that they're required to accept the child's gender identity. They don't need any medical documentation, etc. If the child, the family says that their gender identity is a girl, then the school needs to accept that. They need to customize and optimize the support for that child within that school setting. Including the locker room, they need to provide accommodations within the locker room. If the child is uncomfortable in the locker room, then they need to provide other accommodations that are kind of as the least restrictive possible. Conversely, though, if there's a trans kid in the locker room and other students are aware of it, and another student is uncomfortable, then the thing to do is not to move the trans kid out of the locker room, but to provide other accommodations for the child that's uncomfortable. There is no specific guidance regarding competitive athletics, and I think they're taking that on a case-by-case basis, as far as I know. And then I couldn't find anything as far as if a student came to a teacher and said, I'm transgender and I'm using different pronouns now, but my parents don't know, so don't tell my parents. I don't know what advice the DOE is giving to its faculty or its teachers as far as that's concerned. So transitioning in a school setting, there's social, and just the same three: social, legal, medical. And as we talked about, it's it's the same kind of changes that we mentioned in the definitions. For kids in Hawaii schools, you really don't need documentation. You don't need a medical diagnosis. You don't need a diagnosis of gender dysphoria. You don't need to be on hormones. You can just proclaim that's who you are. For legal transitioning, it's really not necessary for the younger kids. It's more adults and adolescents that might want to change the markers on their driver's license, etc. And in terms of the Hawaii laws, so if you're trying to change a birth certificate, if you want to change the gender marker on a birth certificate, you're going to need a physician documentation of that person's gender identity. If you're trying to change driver's licenses in Hawaii, it's actually pretty simple. You just check the box. And Hawaii has both male, female, and an X for people who are non-binary. Name changes, you have to go through the lieutenant governor's office and have both parents consent. Children over 10 actually need to consent themselves. And then you might wonder, well, why does it need to be published? And usually in the Star Advertiser. And the reason is not because of transgender people, but this is for, for forever and ever, people would try and change their name to avoid predators. And so that's the rule was established that way, and not because of transgender individuals. In terms of US documents, so Social Security card, you need some form of documentation showing that you've changed your name. You don't need specific documentation for gender markers, but you only have male, female choices. If you're getting a passport for your kid, you've got to apply for a new passport, but you do have an ability to have M, F, or X as your gender marker, and you need parental consent from both parents. Medical transition, I'm going to talk about puberty blockers and hormones. Puberty blockers, benefits of puberty blockers, it gives the child time. So if you're a 10-year-old girl, or I'm sorry, female sex assigned at birth, but you're a trans boy and now you're developing breasts, it's sort of hard for you at 10 to decide, I really want to maintain myself as a boy and ultimately as a man. And so if you block puberty at that age, then you give the kid more time to decide. And it prevents those unwanted puberty changes that are sometimes irreversible. It does improve their mental health. I mean, they don't have that anxiety of, I'm a boy when I'm getting breasts. So those are all the benefits. The negatives around blockers is that you remain in early puberty for a long time. So I think all of you have had kids who have constitutional delay. And so these are the kids who are, 14 and still are 10 or 1. And so, you're in the locker room and with a bunch of other people that, look like adults and you still look like a, little kid. So that has its psychological consequences. There's some question about bone health. There was lower bone density in trans kids who had been on blockers, but there's lower bone density in trans kids pre-blockers. So it's unclear whether is this related to the blocker state, or is this related to the blockers themselves? I don't think we know the answer yet. Cognitive effects, there's still no definitive answer on that. It's more of a question just because there's a lot of brain maturation going on in the teen years. Fertility, it is kind of been thrown out there, but I mean, I think there certainly has been some transgender people who have been able to, there have been some trans men who have been able to carry a pregnancy to term. And then one last thing for trans girls or trans women, if they're blocked, then they really don't get penile growth. And if you're a trans woman and you are going to have surgery to create a vagina, the way you do that is the surgeon uses the skin of the penis as the bulk of the new vagina. And so then if there's less skin, then it's much more difficult to construct a new vagina. As far as who should be blocked, you don't want to block somebody who's 10 or 1 because they haven't started puberty yet, so they don't need to be blocked. And if you've gone completely through puberty, there's not a lot of reason that you should block them at that point. At that point, you may just do other things. It's expensive. So if it's not covered by insurance, it's tens of thousands of dollars per year. In Hawaii, it's generally pretty well covered by most insurances. How do they work? So it was always confusing to me because, in the normal state, GnRH, from the hypothalamus, stimulates the pituitary to release LH and FSH, and puberty proceeds. But then the puberty blockers are GnRH analogs. So aren't they doing the same thing? And that was always confusing to me. But the difference is really how they're administered. So in the physiologic state, it's pulsatile. And in the anti-fertility state, when you're trying to block puberty, it's continuous. And so the continuous bombardment of the pituitary with GnRH, in my mind, just causes the pituitary to give up and it stops secreting LH and FSH, and then puberty is blocked. I'm sure the endocrinologists out there will have a much a more detailed explanation and probably a much better explanation, but simplistically, I think that's my explanation. So medical transition, I think probably the take-home message here is that androgen will have its effects kind of regardless of what estrogen is doing. So if you're a trans woman or a trans teenage girl and you're wanting to be have your to be female in appearance, then when you give estrogen, yes, your breasts will grow, and yes, your fat will redistribute to look a more female body habitus. But if you don't block testosterone, and if you still have testes and you don't block testosterone, then your voice will change, and you'll get facial hair and acne, and your testes will grow, and your penis will grow. So you have to block androgen if it's still being secreted. And then the flip side for transgender teenage boys and men, if you give estrogen, or if you give testosterone, then all of those male things happen, and a bunch of the female things do get actually suppressed. So you can often get cessation of menses and infertility, but importantly, not always. I think you do need to know that trans men, if they're having penetrative intercourse, can become pregnant. So they really should have some form of pregnancy protection, some form of contraception. And if they do have some vaginal bleeding, then they should have some form of like a progesterone or something in order to keep them from bleeding if that's an undesired effect for them. And it most likely would be. Gender affirming surgery. I'm going to talk a little bit about that, but I thought I wasn't going to talk in depth about it because it's mostly for adults. And since this is more of a pediatric talk, I wouldn't talk extensively on it. But most places or many places you need to be 18 at least to have gender affirming surgery. The AP says you can have it in less than 18 on a case-by-case basis. The WPATH, which is the World Professional Association for Transgender Health, also says you can be under 18, but it should be case-by-case. And for phalloplasty, which is the creation of a penis, they recommend that you, because of its complexity and rate of complications, that you be at least 18 before you have phalloplasty. So for surgeries for trans women, you could have facial surgeries because if you've had male puberty, then some of your facial features can look a little more rugged. You can have an Adam's apple that sticks out more, so you can have that kind of shaved down a little bit. You can do some things with the bony structure of your face. For voice, they can do laryngeal surgeries to raise the timbre of your voice. And then for gender affirming vaginoplasty, they can create external genitalia that are female and also create a new vagina. And then for trans men, then it's phalloplasty. It's creation of a penis and then breast reduction or breast, reduction. Before I go back to that, I missed one thing for trans women. You can have breast augmentation as well. So one thing to know is that if you've gone through male puberty and then you get subsequent estrogen, only about 10% of those trans women, just with hormones alone, get to an A cup. The other 90% are double A cup or smaller. And so many trans women will choose to have breast augmentation just because their breast just didn't grow very much. And then in the news, there's been lots of news about trans athletes being banned from girls' sports. It's gone from 10 states in last year to up to 18 states in this, and since the end of 2022 and into 2023. And then detransitioning has become a bit of a thing. Troy Peters wrote this book, Detransition Baby, and I'm just going to read through a review by Emily St. James and Vox, and she writes of this book, detransitioning is something of a live wire in trans discussion. Yes, detransitioning exists, and yes, many go on to live happy, fulfilling lives as the gender they were assigned at birth. But even more people halt their gender transitions because the world makes it really effing hard to be a trans person, and nobody should be subjected to that much pain just to be themselves. It may be easier to go around lost in a fog of oneself than to suffer just for being yourself. The existence of detransitioners is often used as a cudgel against trans people by cis-normative society. That the regrets of those who are who detransition are too often privileged over the needs of the vast majority of trans people who pursue medical transition underlines just how thoroughly social internalization, society internalizes cis people as normal and trans people at best as unfortunate aberrations. So I think you'll see this out there, and I just wanted you to be aware of it. And then kind of close to the end, I would encourage you all to go and see this video. It's about an 18-minute video on Kapaimahu. These stones that you see in the picture on the left and the wider shot on the right, they're right down there in Waikiki. And there's a legend that poor Mahu came 700 years ago to the islands, and as a tribute for all of the healing that they did, the local people dragged these big boulders from Kaimaki down to Waikiki Beach. And then when the Mahu left, they imparted healing properties to the stones. And so again, it's a good little video, and we'll tell you more about kind of the Mahu in our islands. And then lastly, we need your help. So if you are a PCP and you see kids or adults, we want to know, like, what do you know about transgender health? We also want to know what your comfort levels in treating trans youth and adults, and then what and how you would like to learn more about transgender care. So either go to the website listed below, or scan the QR code. It's not a very long survey. I think I completed in maybe 4 or 5 minutes, something like that. And with that, I will take questions.
Thank you so much for sharing and for this amazing presentation. I learned so much, and it was just another reminder of really, as much as I feel educated and competent in this field, there's still always so much to learn. So we have one question in the audience right now, which is, or two. The first one was if you have any more information on how the birth certificates are changed, and if there's a note of the change for reference.
I don't have a specific. I can find it and send it out. I think there are some standard forms that people have used, but I don't know if there's something that's specific to Hawaii that, you know, there's a Hawaii form that's generally used. I don't know that, but I'll find out and I can send it along.
No problem, and thank you. Second question was, are there any other community resources for patients with the Lavender Clinic possibly closing due to funding issues?
You know, the Stanford team and you know, working on that to provide other resources. I can certainly be a resource. I mean, I know that, but I'm happy to be a resource for anybody.
Thank you. And I agree. Maya was just saying she hadn't heard about the Lavender Clinic closing, and neither did I. So
Actually, I've heard that, although I haven't heard. I mean, they certainly have. I haven't heard of an official announcement from them. But they, you know, they're supposed to have an open house in a couple of weeks, and they got canceled. So I think that seemed to have been a bit of a clue that yeah, this is happening.
absolutely. And then I'm sure everyone saw that the poll questions are up as well. I don't know how far we've gotten through with those. I'm still halfway through, but I'm sure everyone else is doing better.
Any other questions for Dr. Lum? And that Stanford poll, that Stanford survey, I think you get a gift card if you complete
Yes,
it.
I guess I didn't mention that, but there's a $25 gift card as an incentive, you know, and for your time and effort for completing the survey. So please fill it out. It'll help us to kind of determine kind of future directions for how we're going to be able to improve trans care here in the islands.
And Dr. Maxim has a question. Hi, Maya.
I was wondering what suggestions you have for PCPs when the parents are not on board, given that like such severe consequences of not having a supportive family environment that you showed in that graph, and that we know that a lot of people still have very prejudiced views or kind of authoritarian parenting styles. What would you recommend in terms of best ways to support a patient whose parents didn't know and it wouldn't be safe for them to know, or you know, wanted care that the parents wouldn't agree to, or things like that? Are there resources out there? Do you have like quick tip suggestions? Because I know we have only a couple minutes, and that probably could be a whole nother talk.
Yeah, it certainly could. I mean, some of it might be just also trying to kind of figure out where the parent is at. I mean, you know, and trying to align yourselves where you can. So saying, well, we both want what's best, you know, for your child, and then kind of pointing to them that, you know, that there's a lot of good information that's saying that providing a supportive environment is really helpful for your child. I think, you know, giving them facts, and then, you know, showing them that, you know, that some of the information and disinformation that they may have gotten is really not true. I think sometimes they also just get to see that, wow, you know, when I support my child, then my child is so much happier that they come around.
So kind of thinking about like one step at a time rather than you have to meet them where they're at right now, or is that harmful to the child to take a one step at a time approach?
I think, I don't know that it's harmful, but I think it's sometimes necessary, right? I mean, you have to, it's a process, and you're not going to get parents there. I mean, if they have no experience with this is like, it's earth shattering. It's, you know, it's just really hard to get them to, you know, to come around. I mean, I think so. It just takes a while. And you just have to be, I think, patient with them and just try and move the needle slowly.
Thank you.
The poll is done. If you want to run through the answers, I just noticed, sorry for my typo on number 2. That's my fault.
Well, where are we? How do I get there?
Oh, you can you not see it? Okay. I can just read through the questions and maybe you can go through the answers. So number one, you can tell someone's gender identity by observing their behaviors, true or false. Everyone answered false.
Yeah, because right, it's as we talked about, identity is kind of what you hold in your heart and your mind. It's not your expression.
And number two, I don't know what I was supposed to say. Of a
Orientation.
orientation of a transgender man who is romantically attracted only to women is 73% said straight, 18% said lesbian, and 9% said indeterminate.
Yeah, so it's a man who's attracted to women. So any man who's attracted only to women is straight. So it's you use the gender, you use the identity. So you don't, if you just forget transgender and you say men who are attracted to women are gay or or straight, they're straight. And it doesn't matter whether you're a transgender man or a cisgender man. If you're a man of any flavor and you're attracted to women, you're straight. So that's how I know. I was always confused about that too. So if you just look at the nouns, man, woman, you'll know whether you're gay or straight or or bi or whatever else. But that's how you determine.
Thank you. Number three, most children have stable sense of their gender identity by age 4, but many parents may not know their child is trans because, and everyone said both. Both answers were correct.
Yeah. So I mean, so again, we talked pretty much about that, right? It's children don't necessarily have all the language skills, and then they keep getting all of these opposite signals about, no, you're a boy, but I'm a girl. No, you're a boy, and so yeah, so they I didn't come out till I was an adult. I mean, so it's there certainly are people that it takes you a long time before you really can claim your identity.
Final question, number 4, Hawaii DOE allows transgender children to, and mostly everyone answered all of the above to the choices there.
Yeah, so kids can participate in single-sex PE class, and then again, the issue really is competitive athletics, and we still don't have a firm ruling on whether. I think they do it on a case-by-case basis as far as competitive athletics, but there hasn't been any definitive thing on competitive athletics as far as I'm aware. I know we're at time, but there are other questions. I'm happy to take questions offline too, or afterwards if I'll stay on for a while if anybody has other questions, whether it's a surgical topic or anything else that I didn't cover very much.
Thank you so much again. I don't see any other questions in the chat right now, just a lot of thank yous for the amazing presentation and all the new information. Confusing but very informative. I agree. I'm definitely learning and practicing all the terms as I go. And so yeah, thank you again. And thank you everyone who was able to join us.
Thank you. I've just posted the link for all of Dr. Lum's resources, and she's also has a great list of books and websites that she shared with us that I've posted on that the link there.
Yeah, use those resources. There's a lot of different resources for parents, but there's children's books. I mean, one of my favorite books is The Story of Ferdinand. I don't know if you read that when you were a kid, but it's one of my favorite stories.
Thank you, everybody.